right, it's time to get your medical questions answered. The number to call, 608-270-9933. Dr. Zorba Paster is here. Welcome to you.
Hello. Good to be here.
While we get some calls cleared here, you found an interesting study.
Right, it's a new test. British Medical Journal looked at some data, and they're looking to see what really predicts health and wellness. So it was a test that started about 20 years ago, and if you can stand on one leg for 10 seconds, then you are much less likely to die over the next 10 years.
So 10 seconds.
10 seconds.
You're going to try it.
Should I give it a try?
I don't have a leg to stand on.
Wish me luck,
So why is this?
Well, first of all, not exactly sure why. We know that people who are overweight, diabetes, hypertension, other things, but it appears to be an independent risk factor. We're only at 4 seconds now, right? It's an independent risk factor. Now, making him laugh so he doesn't stand on the leg.
I think we got 10 seconds.
That's, I think, easily.
Should I try the other one?
No. All you need is one leg. You don't need both legs.
So what's
only
the
one leg.
thought about it?
Well, first of all, balance. It turns out you can work your muscles, you can really be strong, but once you get to about 60 years of age, your balance begins to deteriorate. And if you have other problems, it begins to deteriorate even more. Diabetes, as I said. But even cancer rate increases if you can't stand on your leg for 10 seconds. So the idea is maybe that's a test we should be doing in the office.
Yeah.
And say, you can't stand for 10 seconds, we've got to do some more studies to find out why.
That's why a lot of elderly people fall, too.
Right, and that is a big issue in Wisconsin.
Yeah,
big issue.
Yeah, those exercises to keep balance up are really important.
All right, we have some phone calls ready here. Let's go to Louise in Richland Center. Hi, what's your question?
I'm still standing on one leg.
Congratulations. Congratulations.
I'm over 65. I had the J&J COVID shot and the booster, but now I haven't heard anything about another J&J booster. So what should I have for a booster?
Well, first of all, if you've had J&J, you get 2 boosters. You get the first booster, and then a certain number of months, I think it's 5 months later, you get the second booster. So that's ultimately what you do. There is no J&J booster at this time.
So she should get a Moderna or Pfizer?
Moderna or Pfizer booster, right.
Thank you.
All right, thanks for calling. Let's go to Steve in Madison. Hi, Steve.
Hi.
Hi, you there?
Yes.
Go ahead.
Am I talking to...
You're talking to Zorba. Go ahead.
Oh, hi, Zorba. I have really bad neuropathy pain in my feet, and I've tried medications, gabapentin and stuff like that, and it's giving me no relief. And I'm wondering, what else can I do to alleviate this?
Oh, sure. Well, first of all, that is a common problem. The drugs gabapentin, the drug pregabalin, which is Lyrica, can be used, sometimes using a diclofenac ointment that you can now buy over the counter without a prescription. It's an anti-inflammatory at work. What you really need, you need a good physician, PA, or nurse practitioner to work with you and look at a combination of medications. Because sometimes using an antidepressant, tricyclic antidepressant with gabapentin and others will work. So that means you and your doctor, you and your practitioner have to work hard on that. That's what I'd recommend.
Well, up next we have Audrey from DeForest. Audrey, what's your question?
Hi, I'm calling because I've had this on-again, off-again issue with my fingers. They will, like, lock together. They won't bend. They stick together. Sure. And I don't know what's going on. I've had problems with cramps, like in my legs, and I have a lot of back problems. I don't know if there's any relation, but what's causing this thing with my fingers, and what can I do about it?
Well, first of all, it's hard to tell. A lot of people have something called trigger finger. So their fingers go like this, and then you have to push them to get them up, in which case you can actually get an injection from your physician. That can make a big difference. But also, other medical problems can also cause cramping. This is really got to talk to your doctor, find out what may work for you.
Dehydration, too, Mike?
Dehydration can be an issue, too. And electrolyte abnormalities in the sodium and potassium in your body.
Okay, I don't think we have time for another call. Do we? No, we don't. All right, so get your boosters.
That's right. Stand on one leg.
Stand on one leg.
Carefully.
I'm going to have to try it. Everybody's doing it now. Everybody at home is standing on one leg. Zorba, good to see you.
Good to see you.
Thank you all for calling. We'll do it again next week.